Most people believe that staying healthy means doing more tests, more checkups, more scans. We're taught that if we're not constantly monitoring our bodies, we're neglecting them. But what if I told you that after the age of 70, some of the most common medical tests you've been told are essential, could actually harm you more than help you? I know that sounds shocking, even a little frightening, but this isn't fear-mongering. It's truth. And today I want to share something that could change the way you see your health forever. If you're over 70 or love someone who is, this might be one of the most important videos you ever watch. Because as we age, our bodies change, and so should the way we approach healthcare. In the next few minutes, I'm going to walk you through 7 common health checkups that you may be better off avoiding. Not because you don't care about your health, but because you do. Because you deserve medical care that respects your age, your dignity, and your goals. Not a system that overwhelms, overtreats, and overtests. Please, stay with me till the very end. And if you find this video helpful or eye-opening, don't forget to subscribe to our channel, like this video, and share it with someone you love. Now, let's dive in. 1. The colonoscopy trap. Let's start with a big one. Colonoscopy. For decades, it's been hailed as one of the best tools for preventing colon cancer. And for people in their 50s or 60s, that's often true. But past the age of 70, especially if you've had previous clean screenings and don't have symptoms, the equation changes drastically. Colonoscopy involves full sedation, a lengthy bowel preparation, and the insertion of a scope deep into your digestive tract. That's a lot even for a younger adult. For seniors, it can be overwhelming and dangerous. The prep alone can cause dehydration and electrolyte imbalances, leading to dizziness, confusion, or even falls. And sedation, in an aging brain, it can trigger something called post-separated cognitive dysfunction, brain fog, memory loss, or confusion that lingers for weeks, even months. I knew a man named George, 82 years old, sharp and active. He had no digestive problems, but the doctor recommended a routine colonoscopy. During the prep, he became severely dehydrated. After the test, he was groggy, fell in his home and fractured his hip. That one preventive test led to 6 months of rehab and emotional stress. And the colonoscopy didn't even find anything. And here's something most people don't know. Colon polyps often take 10 to 15 years to turn into cancer. If you are in your late 70s or 80s and have no symptoms, the chance that a polyp would affect your life is extremely low. So why put your body through something so invasive and risky? There are safer options like non-invasive stool tests that can offer peace of mind without the physical toll. This is about smart care, not fear-based care. If this resonates with you, I encourage you to comment number 1 below and tell us your thoughts. Go, full body scans. A false sense of security. There's something seductive about the idea of a full body scan. It sounds so futuristic, like you're peeking into every corner of your body before anything bad can sneak up. But for older adults, full body scans often open the door to a nightmare, not peace of mind. Why? Because these scans detect everything, including harmless things that would never hurt you in your lifetime. Little spots, nodules, shadows. These are called incidental findings. They sound scary, they lead to follow-ups, biopsies, and even surgeries, but many of them are completely benign and would never have affected your health. I met a woman named Betty, 78, who went to a health fair and got a discounted full-body scan. they found a tiny spot on her kidney. Doctors rushed to biopsy it, then removed it surgically. It turned out to be harmless. But she spent months recovering from complications, drained emotionally and physically, and regretting the whole experience. The worst part? These scans often aren't even covered by insurance. You end up paying out of pocket, not for clarity, but for confusion. Your body at this age is not a machine to be constantly examined. It's a living, breathing testament to decades of life. Listen to how it feels. Trust that wisdom. Don't chase shadows on a screen. 3. Cardiac stress tests when the treadmill becomes a trap. Heart health is deeply personal. The idea of a sudden heart attack is terrifying, and rightly so. But that fear can push seniors into taking cardiac stress tests they don't actually need. A stress test pushes your heart to its limit while it's monitored. Sounds smart, right? But past 70, your heart and blood vessels have naturally changed. These changes often trigger false positives tests that suggest a problem when there isn't one. That leads to more tests, angiograms, catheterizations, stents, sometimes even surgeries. Harold, a 76-year-old grandpa from Illinois, had no chest pain, no fatigue, nothing. But at his yearly checkup, his doctor ordered a stress test just to be safe. That test led to a stent being placed unnecessarily. He developed internal bleeding from the blood thinners, ended up in a hospital, and spent months recovering, all for something that never needed fixing. Experts now agree, if you have no symptoms, a stress test isn't just unnecessary, it's dangerous. If you're walking every day, breathing well and sleeping okay, your heart is probably doing fine. Trust your body story, not just a machine's. If you're finding this video valuable, please take a second to like it. And don't forget to subscribe to our channel for more powerful, life-changing insights. Your support helps us continue creating meaningful content for you and your loved one. 4. PSA tests when screening causes more harm. Men over 70 are often still given PSA tests to screen for prostate cancer. But what many don't realize is that prostate cancer is usually very slow growing. In fact, most men who develop it at this age will live with it, not die from it. But once a high PSA level shows up, the fear kicks in. Doctors rush to do biopsies, painful and risky. Some go further into surgery or radiation, which can cause incontinence, impotence, or infections. All this for a cancer that may have never caused problems. Will you risk your independence, your intimacy, your peace for a shadow on a test? Many medical guidelines now advise against PSA screening in men over 70 with no symptoms. If you're not having urinary issues and you're feeling fine, think twice. 5. Mammograms. After 75, the overdiagnosis dilemma. Breast cancer screening has saved countless lives, but for women over 75, especially those with no family history or risk factors, routine mammograms can become more harmful than helpful. Why? Because they often pick up abnormalities that would never become dangerous. But the word cancer causes panic. So more scans, biopsies, and surgeries follow, even when they weren't necessary. At this age, the risks of procedures and the emotional toll are much higher. Radiation exposure, anesthesia, infection risks, these things aren't just minor at 75. They can be life-changing. Instead of routine mammograms, many experts recommend personalized care. If you notice changes in your breast, new lumps or pain, absolutely speak to your doctor. But Without symptoms or risk factors, reconsider whether the test is right for you. 6. Bone density tests. When to let it be. Bone density tests or DEXA scans are often used to diagnose osteopenia or osteoporosis. And while they're helpful in early aging, after a certain point they start to cause more confusion than clarity. Why? Because almost everyone over 70 has some degree of bone thinning. But that doesn't mean you need aggressive medications. Drugs used to treat bone loss can cause serious side effects like jaw necrosis, GI problems, and even rare fractures. A better path? Focus on prevention through natural means. Eat calcium-rich foods, get vitamin D, do light weight-bearing exercises, and protect against falls. You can build strength without jumping onto the prescription merry-go-round. 7. Routine blood panels. Just to check the anxiety trap. Let's be honest, there's a comfort in routine blood work. It feels like you are staying on top of your health. But as you age, small shifts in lab results are often normal. A slightly low sodium or a mildly elevated liver enzyme can send doctors into panic mode, even when you're perfectly fine. These incidental findings lead to more tests, more appointments, and sometimes medications you don't need. And suddenly, instead of living freely, you're trapped in a cycle of worry and white coats. Unless you have a specific issue or symptom, routine blood panels every few months may not be necessary. Health is not just about perfect numbers on a screen. It's about how you feel, how you function, and how you live. Aging is not a disease, it's a journey, a privilege, and it deserves care that honors your body, not punishes it. Growing older doesn't mean growing helpless. It means becoming wiser, braver, and more thoughtful. It means knowing when to say yes and when to say no. Just because a test is offered doesn't mean it's right for you. The courage to decline is not weakness, it's wisdom. Ask your doctor, will this test improve my outcome or just add more worry? Remember, medicine should serve you, not the other way around. If this video made you think differently or gave you a new perspective on your health, please comment below and tell us what stood out most to you. Was there a test you now see differently? And please like this video, subscribe to our channel, and share this with your loved ones. You never know who needs this message today. You've earned the right to live on your terms, not overloaded with procedures, but full of clarity, strength, and joy. Thank you for watching. We'll see you in the next video.